Good afternoon, everybody. Thanks for being here. We'll go through some data. I have Dr. Gupta here too to go over a case study that we recently did, which really gives visually gives an idea of how really infectious the virus is still, and also the type of work that goes into each case. But let's start. Today, unfortunately, we lost another member of our community. He was a Caucasian male in his 60s. So certainly, let's think about him and his family. The 212, or we've now lost 212 of our neighbors to COVID. So certainly a sobering day. Looking at testing, weekend testing, always a little bit lighter. We had 1876 tests completed over the last 24 hours. If you look back in the beginning of the pandemic, that was probably one of our bigger days. And now on the weekends, we're saying that's a light testing day. It shows you how far we've come over this period of time. Daily positive rate, 0.8%. 7-day rolling average, 1.16%. So certainly last week we saw a tremendous amount of pressure with cases in the 60s a couple days, in the 50s a couple days. And I think yesterday we had it in the 30s, 37 cases, I believe, yesterday. But you just don't turn this around in a couple days. It takes weeks for us to see the changes in the modifications in people's behavior, essentially, to see really the whole trajectory change. The good news is it looks like it's coming down a little bit. We'll get into today's data in a second. 25 individuals in the hospital, 6 in the ICU. As cases go up, a percentage of cases will always lead to hospitalizations. So certainly that's not a surprise. When we look at who's in the hospital, 18 Caucasian, 4 African American, 1 Asian, 2 of another race. When we look at overall positive cases since March 16th, we've now had 5,105 positive cases. That's 28 new cases. Out of the 28, what's the story? We've had 2 travel, 1 the state of Pennsylvania, 1 the state of Alabama, 5 household contacts, so that number's down a little bit from where we've seen it. That's good. Hopefully it stays there. Then we had 21 community spread, of which 11 of them are from a known source via contact tracing. We have, so that's 21 community spread, better than where we've been the last few days. Hopefully we're starting a new trend here. Looking at recoveries, we've had 4,391 people who've recovered, and actually 4,543 people have recovered to date. Active cases, 355 active cases. Looking at who the cases have been, 2,884 female, 2,221 male, 633 under 19, 1,113 in their 20s, 686 in their 30s, 613 in their 40s, 724 in their 50s, 525 in their 60s, 348 in their 70s, 294 in their 80s, and 169 in their 90s. Related to school testing, again, a reminder for designated testing site at MBT Bank Stadium for school testing, 2 types of tests: a saliva test, which is very popular for children, and the diagnostic nasal swab as well. So we have 2 lines. One lab is through Upstate, one lab is through Cayuga Health. If you want to get a diagnostic test, you can show up that day. We ask that you still try to pre-register for the sake of speed at register.cayugahealth.com. If you want a saliva test, you need to get an appointment in advance, create a MyChart account with Upstate. You can do that by doing mychart.upstate.edu, and then you can go right on. I have a MyChart account. You can go right on and schedule a test. very easy. But because it's a very popular test, you're probably not going to get in that day. So if you want to test that day, your child has symptoms of COVID, they get sent home from school, you want to test that day, go, bring them there, get the nasal diagnostic test. There are other testing sites for everybody else. There's primary care physicians have the COVID tests, Syracuse Community Health Center. Upstate's not this, the hospitals have their own sites, but Upstate's also at the fairgrounds as well. So there's other places to get a test. But this is our specific testing for back to school, and we continue to expand on that. We've been doing asymptomatic saliva testing in the schools. Today we're at the Onondaga Central School District, focusing in on the adults, as we've seen more cases with adults going into the building than we have students. Tomorrow we will be at the Clary Middle School. Wednesday we'll be in the Lincourt schools. Thursday we'll be in the Solvay schools. And Friday we will be at Fayetteville Manlius for asymptomatic saliva pool testing. All testing is voluntary, and to date we have not had any pools for the asymptomatic program come back positive. You've heard us talk a lot about the fact that we've had what we'll say potentially avoidable cases. The one person who gets sick, probably not avoidable, but what happens with that person at that moment? Do you stop and get a COVID test, recognizing you have symptoms, and therefore staying home until you know the results to further stop and box in transmission? And over the last, I'd say 3 to 4 weeks, we've seen a lot of incidents where this hasn't happened. You've heard me talk about this for a week. So this is key as we move into wintertime. We're seeing a seasonal shift in cases right now. Are people saying a second wave of COVID? Is it happening? I think it could happen if we don't continue to be diligent. But I'm at least analyzing when I look at this for myself is the hospitalizations. A second wave to me is when we have hospital numbers where we had them in the first wave. And so, but what can we know what we can do to proactively stop the spread, help to starve this virus. And so Dr. Gupta is here today. I'm going to show you a case study, and this is a real case. But what you're about to see shows how the virus spreads into different networks. But also, for us, this creates an amazing amount of work on quarantines, on contact tracing to do this. And that puts stress on the infrastructure. And it's always been about flattening the curve. We've been able to do that in our community. But to keep the curve flattened where it's not pushing our medical infrastructure, the community is the one who is really responsible for that. So let me show you this chart, and then I'm going to have Dr. Gupta come up for a couple comments. So what you're seeing, and Dr. Gupta will come up and comment, but essentially what you're seeing is the purple box is a setting where we had an individual who spread it in that setting. Then they go out to a couple of the other circles. They're circles, not boxes. The other circles are related to where these individuals then went, different food establishments and restaurants. And then you can see that it got back into the homes, and then you can see that it went into other work environments. Next thing you know, from one case where somebody had symptoms, you have 55 cases. So I'm going to have Dr. Gupta come up and talk about this right now. Doctor, come on up.
Thank you. Okay, I just wanted to explain this a little bit more further in terms of that how what you're seeing, the key to this is that the green one is the food establishment in the center. You can think of any food establishment throughout our community. Then the purple one is your educational institution. Then you have the orange, sort of a reddish orange, that is another food establishment. So proximity of one establishment to another one, then connecting with the educational institution, then having people go back to their own homes, right? So you have here, people came in, kind of hung out together. They're all different people. Their incubation period was about around the same time. So they are coming from all different places and congregating it there. They are going home and going to work and spreading the infection unknowingly if they are asymptomatic, or if they had symptoms within 2 days of before they had symptoms, they started to trickle it down to different places. And also, if you think of educational institution, not only those person who was here and then went to this educational institution, there were other people who came from community and then brought the infection from some other place. So, and you have the same situation in the other box, which is another food establishment. These are the other workplaces where people go and work because they were and then also these are household contacts. There are keys to that. I think if you look at this diagram very clearly and spend a few minutes, it will give you what is happening in our community, actually throughout the world, let's put it that way. It's a microcosm of what is happening, like a small fires. We are trying to put it out every day by investigating each and every one of them. You can think of that many people. If they have 1 contact or 10 contacts or 15 contacts or 50 contacts, depending on what each person is actually doing in their own life. So those putting the small fires are the one which public health does, because we put so many people in quarantine, and we want to make sure that people, if those people become symptomatic, they are not going to spread it further. So it has become more and more complicated in what we call old days, and when we have the April or May, all those cases, the county was closed to a great extent, and this was throughout the New York State. Our work was a little bit straightforward. Now, one person can take quite a bit of many hours because that person, he or she, is going to many different places. So what county executive has been continue to convey that for last several weeks, and then reminding people, I'm here to remind again that this is truly, these are the cases has happened. We did not want to put any establishment name because it's applicable to anywhere. It could be worship, it could be restaurant, it could be bar, it could be any manufacturing place, it could be a construction place, it could be any big party anywhere. So you can put any scenario in this, and that is happening. And the reason for bringing up this here, that power is in people's hand. If people go and put the mask on, and if they keep the distance, and if they're symptomatic, do not go anywhere, that will actually prevent transmission of virus significantly in our community. And as a result, the community will stay open. You can still enjoy restaurant, you can still enjoy your get-together with your friends and family. A little bit of it, we have to give in a little bit. Life is a trade-off, right? So if we give up a little bit of our pleasure-seeking behavior, that it has to happen now, it will really be very helpful for the rest of the community and for themselves also. So that's what I'm here to remind everybody, that make sure you stay home when you're sick, keep the mask on when you are in public, when you're at your workplace, keep the distance 6 feet or more. That is very important. And if you, and when our investigators are calling, people really should give us all the information. Our investigation cannot be complete unless we get full information for any case. If people forget, call us back. It happens. And you can save lives, and you can see those 2 red are the very important part. These are critical people who ended up in the hospital, who are in critical condition. And what happens to them depends how their clinical scenario goes. And as you have been hearing for last few days, we have been reporting deaths every day, pretty much every other day, which is a concern to us, that we are not trying to go backwards, we are trying to go forward. And we are asking the community to be a partner with us and make sure do the right thing for your family, friends, and to the community, so we can continue to be really successful, which we have done it in the past. Yeah. Thank you.
Thanks, Dr. Gupta. Do that. Wonderful. So I think you've heard it from us. During the summer, we would have a little cluster. We would do this tracing. We'd box it in, and we would be back to good data. The community spread numbers were very, very low, and you can almost point to every case and tell the story. Now it's in the community now, and so the direct correlation with our vulnerable, when they get sick, they have fights, and we've lost neighbors, and because it is in the community, it's getting into facilities, not at the rate that it once was, thank God, but it's there. So we just need to kind of, like we've been saying, grind it out. We have this rate very, very close to 1%. It's a very good rate. We have our economy open. We're starting to see recovery with unemployment going down again. We're seeing an increase in sales tax compared to where we were. But we're a large community. If we let our guard down, things can go the other way very quickly. And so it's just about re-engaging. Let's be smart. I don't think it's lost upon us that after we have holiday weekends, a period of time after that, we see upticks. And so we just need to be smart with our gatherings. We need to be smart with our own families. And certainly we have Halloween coming up. Please, trick-or-treating, small groups, right, with people that you know. Let's be smart as we do this. Saying that, we're getting ready for our budget next week. I know next week's a busy week, but again, we're going to be putting out a document that's going to show the impact that this virus has had on us fiscally and our ability to fight this. Certainly, there's a lot of debate still about stimulus. The reality is, for us, at bare minimum, for us to fight this, to keep the economy open the way everybody wants us to, it takes resources. And certainly, we need the federal government to step up, get their act together, and look at the Problem Solvers Caucus bill, bipartisan bill on stimulus, use that as a model to move this thing forward, because at bare minimum, your governments do need resources to keep the economy open. So saying that, happy to take questions.
Ryan, on that chart, I think you described it as one case leading to 55.
Yeah, essentially, yeah.
Do we know what the one is?
Is
there a start point to that?
I think, Dr. Gupta, where would you say the start point is? The meal? Yeah. Yep.
So we actually debated part of that, whether there is an index case in this situation. When we call index case, it's starting from one case. So if you see there are multiple people here, and we can say this is the index case, could that be index case? Could that be index case? Because the incubation periods are so close together. What we wanted to reflect a lot of times in this situation is that we can have, and this is still continue to go further. We started to keep on going and trying to find the connectivity, the families and friends. So can it continue to grow? That is a very tedious work, which my data team actually does. They have to delve into each and every chart and try to find the connectivity. So it will, I would think that we would not call that started at one case. One case started in one area and going in one direction. The other cases are started to go into that one. And if they are in a one setting, 4 or 5 people in a closed restaurant and the tables are not far apart and they're eating, then you are creating an environment probably that can expose more people. So that's the biggest concern which we have as we are going into the winter, when people will do indoor eating instead of outside, and the crowded setting really opens up the door for outbreaks. And these mini outbreaks can become a big outbreak in the community.
So the green circle, the restaurant is the starting point, and
Yeah,
and
so
11
right, so
people-
this and this, they have a lot of correlationship with each other if they are next to each other, because if you go into any shopping, eating places, they are not far from each other. If you look into any, and most, unless they are freestanding restaurants somewhere in suburb. In general, if you go to a area where there are multiple food establishments, they are in proximity to each other. And people go from this one, sometimes they go to this one, and then we saw that people are going into one and other one back and forth at times also. So that is another, at least what we could see and identify.
And did you mentioned, tables not properly spaced or people not wearing, did you find any violations of the protocol?
Right, so
involved here?
no, we did not. So what we do is we go back and then we ask the food inspectors to go and inspect them, those establishments. We did not find any of those things. We do provide that guidance to the establishment on a regular basis, and in those situations, they will get an inspection that what is happening. They just get a spot check in a way, for the lack of the better word. And if they do find, I did not hear anything back from my team. And I have been very pleasantly surprised to get that all the food establishment, all the places, the workplaces have done an amazing job of keeping the people, their customers, protected by spacing, making all the rooms for that. But they cannot control people's behavior, right? So the people have to do what they, if you are sick, don't go.
But are any of these avoidable transmissions?
Yes, they are. People are going and enjoying things when they are sick,
But they're-
when they have symptoms.
Oh, you found that?
Yeah,
some
that's
people went
exactly is happening. They may have little bit symptoms. They may think, oh, it's nothing. I'm tired. I'm this and that. So we all can make excuses, right? The same thing is happening at the workplaces, because if you are exhausted, pandemic fatigue is happening. People are stressed out with so many other things, their financial situation, emotional stress, and they cannot do things which they could do it, beginning of the year or last year. Things have been postponed. So that stress kind of builds on. You kind of don't want to go and try to think of your symptom. So yes, people are actually going to different places when they have symptoms, unfortunately.
So how many of those 15 or so restaurant patrons had symptoms when they went to the food establishment?
So I cannot tell you exactly at this point, but we have, if you look into our data page, we put that will be proportionately the same. If we have about 1/3 to little less than half becomes are asymptomatic, rest of them are symptomatic. That is applicable throughout. That's what we have actually done, a check on different places. So people going to work, people going to food places, people are attending parties, people are doing all the get-togethers which they are celebrating. That is happening, which when I see those, when I see that it says symptomatic in there, I just feel like, why? And I just have no explanation at that time that if you're sick, I think it will be important for people to stay home and protect others and get tested.
But do asymptomatic people know that they're sick?
Symptoms. I'm talking people who have symptoms. So asymptomatic, yes, there is an excuse for the people who are asymptomatic, because if they got symptoms 2 days later, we are going 2 days, like 48 hours back. That's a little bit different scenario, but we have been disappointed to see that people are going to different places when they have symptoms. And that's where, your heart sinks and you just feel like, why? When you know you are in the middle of pandemic, you cannot take any chances. If you have any new symptoms appear, you go and get tested. You call your doctor, a county executive, just explain everything in terms of how many testing capacity. We have enough, very good testing capacity in this community. There's no excuse for that we shouldn't be testing it.
Dr. Gupta, how many man hours is all of that? How much time, effort, and energy is tracing all of what we see there?
How much time, effort?
Time, effort, energy. How many man hours? How long does it take to come up with this, to track all these people down?
Right.
For
So,
this one specific example.
well, you can think of, if there are so many people here, each and every case has to be interviewed. Their contact has to be identified. They could range from 1 to 50, right, or more at times. And then we have to put them into quarantine. And then if they become cases, then we have to reinvestigate some of those things. So everything keep on adding. When the data team looks at that, they look at each and every chart. So the information you get on every day, it means my team is looking at those many cases every single day and trying to make those correlation. So it's a very tedious, very time-consuming work and the reason we do that, because information is power. We are not making it up. It's a true reflection coming from the records which we are receiving. So it does become hours and hours every day of that, putting the information you get it. And if you take it this happened over the period of several weeks now. So that's how we could put that information in retrospect, that this has happened now and it's evolving.
Just to be clear, this could have been prevented? Everything that happened here?
Well, everything is preventable, right? So I don't want to say that everything is preventable, because people are asymptomatic. So we are not trying to make people uncomfortable. Sometimes you don't know, out of all of us, if somebody becomes symptomatic 2 days from now, we'll say that, oh, who was there in this press conference, right? So people don't do it intentionally. Nobody has any malice in their mind. I do believe that people are good people. When they are even going for symptoms, with the symptoms, either they are going because they are worried about their family, how they are going to earn money, or they don't think that it's COVID, or they just kind of so stressed out with their thing, they didn't even pay attention to their symptoms. So what we want to remind with this data, with this information, that it's real. We are still in the middle of pandemic. We cannot forget that. We cannot be complacent at this point. We have to make sure that we continue to remind that wear your mask, stay home, and if you're sick, don't go to work, and watch out for your friends and family and remind them the same thing. Thank you.
Yeah, I think Josh, if you think about it, you wake up and you have symptoms. If you probably don't have COVID, but if you do, by getting a test, you prevent this, right? So I think that's the way to think about it, is once you're sick, you're sick. But do we box it in then, and then get a hold of that case, and then we put that one to bed? But to give you just an idea of what the consistent data collection looks like right now, 1,706 quarantines and 355 active cases. So that's a lot of people to connect the dots with. But it's a good reflection. I'm glad that the team did this so people can visualize it. This is what we're saying. And what we can control is you can control wearing a mask, you can control distancing, you control the decisions you make and where you go, and how you socialize. And certainly the one thing that we all need to be very, very cognizant of is our own health and the symptoms of us, and then those of us who have children, of our children's health as well, so that if there's any symptoms, they get a test. And I know how inconvenient it is to have kids that need to get a test because they have a symptom. It's happened to me 3 times, but thankfully we're 3 for 3 with negative tests in the McMahon household.
Dr. Gupta, how many contact tracers were working today? And as we see these quarantine numbers now at 1,700, do you see more contact tracers being added to the team as time goes on this week?
System, right?
So we have about 86, somewhere between 17 and 80.
Yeah. So there's about 70 to 86 that don't work at the same time. But also we lean into the state's system as well for contact tracing. The contact tracers do not make the calls for the cases. That's the health department and starting the investigation. But once they do the investigation they'll then have contact tracing. Some of those will go to county health department employees. Others, where we get backed up, will go to the state system. And the state system has gotten stronger over the pandemic.
And does the timing of from the health department finding out to notifying the exposed person, does the time it takes to notify them, is that a metric that you guys use to determine how many investigators you need that day? Because I'm sure time is of the essence and you want them finding out as soon as possible.
Yeah. So it's a great question. So we have, depending on what the caseload is, that's how we do the staffing, right? It's like any operation. You have to do staffing of how many people. So guesstimating based on what is happening now. We used to have in 10s, now we have in 30s cases, or sometimes even 50s. So we will have the case investigators who are ready to take the cases first thing in the morning. They get assigned actually a night before at times, depending on if they came very late night, somebody can do that. And then after we can pull other people to add if we have a surge, certainly. So there are people who are trained. These are case investigators. And each case have contacts, so they are created new record in the system, which is called ComCare, as County Executive was mentioning. That's a state-based electronic medical record in a way that we have to create. If one person created 10, so we will have to create 10 of the records, and then we can send them to the New York State contact tracers, which are sponsored by the Bloomberg's Philanthropy through the state. And that has been very seamless transfer of care from ours to them. We are practically one team. And they, as soon as we put them into the system, they pick it up before you actually can know. Sometimes we want to, in some specific cases, we said we are going to keep that in our, but before you know, they picked it up. So they are very efficient. It has been working very well. And when you look at the schools and everything, we have like lots of contacts which are appearing every single day. So we have been able to actually do that, and we appreciate state's health in that.
And on paper, you would see that Onondaga has a team of around 200, and we're using right now around 70. Without context, someone might say, why are we using less than half of our team?
So, I mean, we are for the case investigators. So for the 200 when we used, they were for contact investigation. At that time, state was not on board. Since the state's contact tracers came on board, then we don't need to use them unless the case state suddenly drops out and say we can't help. Then we have an army of people who will be available here. Right now, we have enough support from the state, and then the county also needs to do other. I mean, the whole county's business is open, right?
Yeah.
So.
Yeah. Remember, public health is more than COVID. So you don't take everybody off everything in the health department to just do that, so that so that's there's other issues as reported on last week. We have an opioid crisis that's been impacted. We have more domestic violence than we've had. We have more child abuse than we've had. So there's a lot of different things too that we still do every day. So right now we have elevated numbers of people working on this than where we were before. But we do have over 200 people that have been trained and certified by Johns Hopkins, Dr. Gupta's alma mater. And so in the event where we get into a surge like that, that would be a very bad situation if we had to have all those people working on this. Other questions?
I'll go again if that's all right. Looking ahead, Ryan, with the amount of people that we do have in quarantine as we come up on Halloween and Thanksgiving and the important days really to people, you need every one of those 1,706 people to quarantine and follow through. And for the ones that are thinking this is going to be tough if I get this call right before I'm set to see my family or whatever, what's the message for that?
Well, it's a legal order, right? So this isn't a joke. We've, there's been circumstances where I think we have now issued subpoenas for quarantine, but if not, we've given the green light to go do that. So this is not a circumstance, and that's why I've always said quarantines aren't fun. You're in a quarantine for a minimum of 14 days. If you're essential, you can, if as long as you don't have symptoms, you can go to work and back in a quarantine. But there's no stopping and and saying hello or going to your favorite restaurant in that scenario. And so I think again, how do we, as a community, we help get these numbers a little bit lower? Is we do what we know that works. We've done it. Dr. Gupta is right. You've heard me say it. There is COVID fatigue. People are tired. We had a great run in the summer, and people got to get their lives back. And then we've got school started, and we had a good run, and we were having success getting school started. But now we got to be in a good spot going into the winter. So what can we do? If we're sick, we got to get tested. If you're going into holiday circumstances where you're going to be in gatherings that are legal but maybe larger, you may want to get tested. You may want to encourage people who are going to be there to get tested. And certainly testing is a key. Again, your flu shot is another way to help preserve the medical infrastructure in this community and help rule out things that are like COVID. So these are things that we can do, and if we do them well collectively in our community, we'll continue to have success.
You're encouraging a lot of voluntary good sense. How close do you think we are to going back to mandated restrictions on nursing home access or restaurant openings or bars?
Yeah, so I think the way we've heard the governor talk about is cluster approach. So what we've been doing is we don't need to get back there, right? And it's so we're doing everything we can to communicate with folks, to do more testing, make it more available, do more strategic testing to try to find the hidden pockets in congregate settings that will drive cases. So we're doing everything we can, and we're going to message like crazy so people get it. Because what we don't want to end up in is in a situation where we have a microcluster here and you get moved into yellow light or orange light, and then all of a sudden those businesses do have to go back at capacity. Your kids can't go to in-person learning anymore, and some of these other restrictions that come with that. We aren't there. We're not close to there right now, but we're a big community. We're a cluster away from having this happen. Imagine if we had 50 people in the same situation and times this, then you're there. So how do it's the decisions we all make as a community that will prevent it. And especially if you're asymptomatic, it's tough you're asymptomatic. You don't know you have it. But if you're sick, you know that you're in a pandemic. You know what COVID-19 is. You need to get a test. And that's what we're going to continue to say daily until we get through this. There's going to be, at some point, we're going to move into another phase of this once we get a vaccine, and we're working on getting the vaccine to our vulnerable and then to our young people and then to everybody else. But until we're through that, we just got to grind this thing out.
So there are 8 workplaces on that chart.
Yeah.
I don't know if you have specific numbers. It sounds like you don't, but you're presuming that some of those people went to the workplace with symptoms.
We know some of them went with symptoms. That we know. Yeah, we know this. Yeah, they went to. We know. No, not all of them, but some of them certainly did. Yeah.
I think what it is relating to you is that these people who went to these food establishments, I'm just looking at there's a known linkage, that's the straight line, the one line, and then the double line is the household contact, right? So you can see that the person went and enjoyed the whatever meal, and then after that their household contact got impacted. Then the workplace also, the people the one other person who's the workplace, I'm looking which one is workplace.
The outer ones.
Other affected workplaces, the blue one, right. So those people, they work somewhere. So when they went to work, either they were symptomatic or they were asymptomatic, they will impact other people. So that's what it's indicating you there, right there. It's just sort of giving you a 30,000 feet view of the whole thing, how even though when you see in one person can impact so many other people that went home, gave it to the family, some people went to work, and if we can also have seen that people went to the play group, people went to some other get together. So this is just the overall view of this. It's a microcosm. That's what I would say at this point. And there are different work. People are working everywhere. The community is open. So that's why we are asking that if you're symptomatic, get tested. Don't go to work. Talk to your supervisor. Talk to your employer, and do that. That's the very important message.
Ryan, I know you're going to be asked about it later this week, but if it were up to you and the county health department, would there be trick-or-treating this weekend?
I think if you do it safely, it's okay. And again, I think with what the guidance that we've given out, the state's given out, if you're going to be giving out candy, if you can leave it out front for the kids to grab it, that makes sense. I know we'll be trick-or-treating as a family in the McMahon household. And so, again, we live together, right? If we're really one. So certainly if one of us had it, there's a high probability we would all get it. So I think if you do it safely, it's something that we can do. And it's balance, right? And so what we've seen, cases are cases. We're going to have them, and we'll probably even have them after there's a vaccine. But it's the cases that are kind of the unforced errors, as we do a sports analogy. The person was sick. They knew they were sick. For whatever reason, they still went out and met their friends. They still went to work. They still went to see mom and dad. These are the things that are normal. We do this as a society every other year. We just can't do it this year. Okay? Other questions? Thanks, everybody.